Hello everyone. Today, we're diving into the world of a medication called polyethylene glycol 3350, commonly known by its brand name, GlycoLax. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Polyethylene glycol 3350, often recognized by its brand name GlycoLax, is a laxative solution used to treat occasional constipation. It belongs to a class of medications known as osmotic laxatives. Polyethylene glycol 3350 works by retaining water in the stool, which results in softer stools and more frequent bowel movements. It is available over the counter and by prescription, depending on the dosage and specific needs of the patient. Warnings: Polyethylene glycol 3350 is generally well tolerated, but there are some precautions to consider. It is not intended for use by individuals with bowel obstructions or intestinal blockages, as it could worsen these conditions. Additionally, individuals with kidney disease should use this medication under the supervision of a healthcare provider, as it could potentially lead to electrolyte imbalances. Before taking this medicine. Before starting polyethylene glycol 3350, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its ingredients. If you have a history of kidney disease, bowel obstructions, or intestinal blockages, it's crucial to discuss these conditions with your doctor before starting the medication. Pregnant or breastfeeding women should also consult their healthcare provider to ensure the safety of using this medication. You should not take polyethylene glycol 3350 if you have a known allergy to polyethylene glycol or if you have a history of bowel obstructions or intestinal blockages. Additionally, individuals with electrolyte imbalances or severe dehydration should exercise caution and seek medical advice before using this medication. Before starting the medication, inform your doctor if you have ever had kidney problems, electrolyte imbalances, or if you are on a low sodium, salt diet. It's also essential to let your healthcare provider know if you drink alcohol very often or if you have ever had a history of gastrointestinal disorders. If you are scheduled for surgery or certain medical procedures, inform your doctor as you might need to stop taking polyethylene glycol 3350 temporarily. Side effects: all medications can have side effects, and polyethylene glycol 3350 is no exception. Some individuals might experience mild side effects such as bloating, gas, upset stomach, or diarrhea. These symptoms are usually temporary and subside as your body adjusts to the medication. In rare cases, some individuals may experience more severe side effects such as severe or persistent diarrhea, abdominal pain, or signs of an allergic reaction, including rash, itching, swelling, severe dizziness, or trouble breathing. If you experience any of these symptoms, it's crucial to seek medical attention immediately. Furthermore, polyethylene glycol 3350 may cause dehydration if not taken with adequate fluids. Symptoms of dehydration include dry mouth, thirst, reduced urination, dark yellow urine, dry skin, and dizziness or fainting. Always ensure you're staying hydrated while using this medication and consult your doctor if you have any concerns. Interactions: polyethylene glycol 3350 might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. This is particularly important if you are taking other laxatives, diuretics, or medications that can affect electrolyte levels. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking polyethylene glycol 3350. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose for adults and children 17 years and older is 17 grams, about 1 heaping tablespoon, of powder dissolved in 4 to 8 ounces of water, juice, soda, coffee, or tea, taken once daily. It may take 2 to 4 days for a bowel movement to occur. For children younger than 17, consult a pediatrician for appropriate dosing. Avoid: while on polyethylene glycol 3350, it's advisable to stay hydrated to prevent dehydration. Given the potential for gastrointestinal discomfort, it's wise to avoid consuming large amounts of high-fiber foods or other laxatives unless directed by your doctor. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ: many wonder about the age restrictions for polyethylene glycol 3350. Currently, it is approved for use in adults and children aged 17 and older. For children younger than 17, the safety and effectiveness are not well established, so it's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of polyethylene glycol 3350. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.